The month of May is Mental Health Awareness Month, and today we have a special guest with us. Megan Ulrich is the Mental Health Liaison with Tippecanoe New School Corp. Thank you so much for joining us today.
You're welcome. Thank you for having me.
Well, and just starting off, your position's fairly new, so can you describe what your position does and why TSC decided to add that?
Sure. So this goes back to January of 2020 is when this role was added, and it starts with a partnership with NCHS, North Central Health Services, and a Resilient Youth Initiative grant. And that was designed to try to get services to all kids in our district, teaching them how to regulate their brain, making sure that they just knew good brain science. So at that point, my role was brought on just to try to make sure that all kids had services and that we were meeting the needs of all kids in mental health.
Well, we hear all the time about, a mental health crisis among, kids and teens. So what are you seeing, on the ground in the schools, and how much of an issue is it?
So the last few years have been very interesting in mental health and really just in the world in general. There's definitely been an increase in anxiety, depression, the need for suicide prevention and awareness, making sure that we're equipping our kids and families with what to watch for, how to act and react if you have a concern. So lots of concerns as far as different needs, and then the need to make sure that we're equipping our families with the information of what to do if they have a concern.
Well, that's great, because I want to ask, what tips do you have when it comes to just monitoring your kids' mental health, and especially when it comes to like social media and things? What effect does social media have, and what can parents do to help their kids out, either with its social media or just all the other challenges that they face today? Well,
and parents know their kids best, so keeping a close eye, and if anything seems off at all, never being afraid to ask the question. You're never going to create a problem by asking a question. And if the problem is there, it's there. And asking questions of how are you doing, what's going on, even when it comes to really scary topics, having that communication, and then reaching out to the professionals if they're concerned that something's going on, and starting with the family doctor, reaching out for mental health services. With social media, monitoring what's going on social media, and making sure that you know what apps do your kids have, who are they talking to, because things can happen. So I think communication and not being afraid to have the conversations.
How much do you think social media is playing a role in the negative or positive impact on kids' mental health?
So social media is a wealth of information, whether that's positive or negative, and so the need to monitor that, and we can certainly use it to get really good information out there, and it can be a source of good information and resources, but it can also be a source of information that our kids don't need to have. So it certainly is a player in all of this, and that's why it's just really important that anything that's on our kids' phones, any interaction that they're having with social media, there needs to be full awareness of what's happening.
All right, well, we're running out of time, but real quick, if a TSC parent wants to, get their kid in touch with you or utilize those programs, what would you say?
So we have a TSC mental health website, which is on our main TSC website. They can certainly reach me through that, all of the schools. So whatever school they attend, that school also knows how to reach me, but they are more than welcome to reach out. I love to have those conversations. That's where all of this starts and all of the problem solving occurs. So.
Okay. All right. Well, thank you so much, Megan, for joining us today.